In this video, we'll be reviewing the Clinical Today module. Clinical Today is the starting point for all clinical users. The appointments seen on this screen mirror the appointments set under the scheduling screen for each resource. We're going to begin in the batch. Each clinical user needs to create a batch for the clinical side of CareTracker. This function only needs to be created one time for the clinical user in the practice. On the clinical side, a batch will control the quick tasks and the appointments that are seen on the Clinical Today screen. To begin creating your batch, we're going to select the batch icon here on the clinical tools. And for the EMR purposes or clinical side purposes, we're going to focus in the middle section of the screen. So we're going to select Edit and start with your provider. This here will have a list of the providers that are listed within inside of your practice. Select the appropriate provider that you wish to see their schedule and their quick tasks on the Clinical Today screen. The next is your resource. This is all the schedules that have been created within inside of your practice. Select the appropriate resource that you want to see. If you work for multiple providers within that practice and you work on multiple schedules, then you can leave this particular function blank, and that way you'll be able to see all schedules. Your next option is your location. Location, if you have multiple locations for your practice and you only work at one particular one, so that's the only one that you care to see, you can select that from the drop-down. If you work in only one location, we still recommend that you select that from the drop-down. This way, when you are opening up orders or you're going to prescribe on behalf of your provider, writing letters, you'll have the provider's name and the office location listed on them. I'm going to select my office here. We're going to skip the all groups default and leave that as yes. Same as your default referral provider, we'll leave as no. The next one that we are concerned with is your show alerts. This here is a yes or no feature, but what this allows is that when you open up a patient's chart to have the alerts pop up when that chart is opened. One thing to note with this alert feature here, the minute that it is changed to yes and you save, you cannot come back in and change it back to no. It's a one-time only feature that by design is once it's turned on, it stays on. So that's one thing to keep in mind. If you do not want to see those pop-up alerts that populate when you open up a patient's chart, you would want to keep this as a no. I'm going to leave mine as yes. Another thing to focus on with inside this batch for the EMR side is your select send lab results to patient portal. This gives you three options: no, send results only, send result in note. Couple of things to note about this option: it's not going to send a lab result to a patient without the provider reviewing that result and signing off. The result needs to be reviewed and actually pushed to the patient portal in order to be seen in the patient portal. The system does not automatically do this. So by setting this, you're not setting up the system to send it automatically. You have the ability to send just the result only or send a result and a note. And what this means is that if a patient has accepted the invite to the patient portal and established their portal, when the provider goes to sign off a result with inside a CareTracker, there will be an option there for them to be able to send that result with a note, if you select this one, to the patient, or they can just send the result only after they've signed it off, as long as that patient has established their patient portal. And then one other option that we're going to focus on is your login application here. This is where your landing page will be when you first log in the morning to CareTracker. Where would you like CareTracker to land when you log in? If you focus on the home screen and deal with the dashboards there, you could leave this as home. And that way when you log in, that's the first thing that you see. If you are strictly on the clinical side of CareTracker, we recommend that you default this to clinical. So that way when you log into the Clinical Today screen. And that way you can begin your day looking at the patients that have been scheduled and the tasks for the provider that you have selected in your batch. And again, if you do just scheduling for the practice, you could actually default this to the schedule, so that way when you open up, you're dealing with the schedule. Once you've selected these few things, you just want to save and close. Now again, this is a one-time thing, so you do not have to come in every day to select a batch. Once it's completed, your batch is now complete for the clinical side. It is recommended for all users, and that's including providers as well. They should select themselves from the batch, so that way they are able to see their quick tasks in their schedule as well. Moving on, we're going to now focus on your options that you have to navigate and filter the Clinical Today screen. You'll see here this first option is your resource option. This has all of the schedules that have been built within inside of your practice. You have the ability to be able to look at all of them at once, or you can look at none and just select one particular provider within inside your practice. If I was to select this one provider, I can now hit the search, and I would only see that particular provider's schedule. If I select this again and I select all, I would be able to see all of the providers within inside the practice's schedule. I also have the ability to see all patients listed on the schedule, or just a patient in context. And what we mean by patient in context is that a patient's name is here listed in context. So if I was to pull a patient into context here, and I'm going to pull in this first patient here, you'll see that now the apple green, or green apple, is now in my context. You'll also see that my alerts have now popped up because I've set this up in my batch. So now, if my computer is in a large populated area where patients are constantly coming through, it could be in the middle of the office. I might have it where it's facing patients, and I don't want patients to see other patients that are on my schedule. I could change this patient option to patient in context and hit my search. By doing that, it's only going to show the patient that's in context, which is listed up here, on my schedule. And this is a great way to make sure that other patients don't see who else is on my schedule. Only that patient would be able to see themselves and be able to not know everything else that's going on in the office. I'm going to switch this back to all my patients here. You could also filter by appointment date. It automatically defaults to today's date. I also have the ability to see yesterday's date. I can see tomorrow's schedule. I can go out to last week. I can go out to next week, the next 7 days, the last 7 days. I also can do custom date range. So if I'm looking for a particular date in general, I can now put in my custom date range here and be able to see all the patients from that time frame. And I would just hit my search button, and it will pull up all those patients from the time frame that I put in here. I can now come back to my today and hit search again, and it now puts it back to today's schedule. I also have the ability to search by status. Do I want to see all the patients that are checked in? Do I want to see all the patients that have been transferred to a room? Maybe they've been changed to ready to provider, or if they've checked out. If I was to select the checked in option here and hit my search, you'll see only the patients that have checked in for that day. You don't see the full schedule. And it's a way to navigate and kind of minimize the schedule, especially if you have a full schedule and you're just looking for particular patients to see if they've checked in already, maybe they checked out. And now I'll switch that back to all. So now I have a full schedule listed here. You also have the ability to print out your schedule charts with inside of CareTracker. This is a great way to kind of plan ahead, especially if your office is in an area that has a lot of storms, such as hurricanes, maybe tornadoes, and you want to be able to still see patients if you can, and have their charts available so that way you know what's going on with those patients prior to that visit, prior to those storms. So it's a good way to plan ahead. It's also a good way to plan ahead in case your office is under maintenance. Maybe your internet is being taken down because they're doing upgrades within your office. So that's something that you plan ahead for. You could print out these particular charts for these patients that are being seen on that day, so that way you can continue to see those patients, review what they had, and then once your internet is back up, you're able to now chart with inside a CareTracker. Within this printed chart, you have the ability to check which resource you want to print from, which schedule. If you have multiple locations, which location. Dates to and from. You could also select today or tomorrow. And then below here, you have the ability to select what you want to print out that pertains for you to be able to see that patient for that particular visit. And if there's something that you don't want, all you need to do is uncheck it. You also could do a chart date range too. You could do all. You could do just the last encounter. You could do last 6 months, last year, or a custom date range as well too. And then you would select Publish. And once that is done, it would be underneath your Publish Reports inside the Reports module. You also have the ability to print out your appointments inside of CareTracker. I know that some practices still like to have that hard copy in front of them as the patient comes and checks in, so that way they can highlight that patient to let them know that they are here. Especially if there's a long line, they might highlight that patient and then have them come back up with the appropriate insurance information when they're checked in. You'll see here it shows you the appointment date that I'm on inside of Clinical Today. It'll show you the patient's name. It shows you the appointment type, the schedule that they're scheduled on, their homework, phone number, and also will show a patient balance as well. This report here is not customizable, so what you see on my screen is actually what will print out. So you will see a balance for a patient. You also have the ability to show non-patient appointments and create non-patient appointments inside of CareTracker. So if I was to uncheck my Show Non-Patient Appointments and hit Search, you would only see patient appointments listed on my schedule. If I want to show only non-patient appointments, not only, I could click this little box here and then hit Search. It's going to show my non-patient appointments. Non-patient appointments can be for maybe a lunch that's scheduled. They could also be for maybe there's a training that's being done inside your office, or maybe there is a drug representative that's coming in that might be giving a demonstration on a new drug that is out. Non-patient appointments can be placed onto the schedule and also be seen on Clinical Today as well. Now let's move on to a patient. You'll see here that Green Apple has checked in, and maybe now they're being transferred to another room. I have the ability underneath this check mark here to select the word transfer. And then I can select which room they are set up. The rooms that are set up inside of CareTracker are set up by the practice, so they can be designed and customizable to that practice, and you can call those rooms whatever you'd like. This is done underneath the administration module for that practice's CareTracker. I'm going to place Green Apple inside of exam room 1, and that's going to change the color of the patient's appointment here. You'll notice that the appointment below that is checked in, is green, and when I transfer that patient, it is now blue. This is just a visual way to kind of track where patients are. This also can be used for efficiency purposes too inside the practice. It's not a requirement that the practice uses this functionality, but it is there if they would like to. You also have the ability to move that once they're transferred to a room. You can now say that they're ready for the provider. So that way, when the provider is looking at the Clinical Today screen, they can see that this patient is ready for them in exam room 1 or whatever you choose to call that room. And you'll notice that it's changed to a nice purple here. Also from this Clinical Today screen, you can click on the resource for the patient. You can also click on the type too. The resource is going to show you the appointment. If there was a complaint written in when they were scheduled, maybe if there was a chief complaint, it will show you the appointment date, what type that they're here for, the location, the place of service, if there was any recall listed. It also shows you an appointment history as well too. Who scheduled it, who checked them in, who confirmed it. You also have your appointment type you can click on as well, and that will show you just the appointment type for that patient. You do have the ability to cancel the appointment from a Clinical Today screen. You have the ability to confirm the appointment from the Today screen. The only thing that you would not be able to do is schedule the patient from the Clinical Today screen. You also can click on the patient's appointment time as well, and that will open up to the appointment detail as well too. You have a status here, so if you are utilizing the check-in, transfer, ready for provider option, you would do so from this arrow here. And depending on which option you select is depending on what color that appointment would change to. And then it would show underneath the status if they've ready for the provider, if they've checked in, if they've checked out. You also have the ability to confirm a patient as well from Clinical Today. You'll notice that next to green apple, I have a little piece of paper with a check mark. And if I hover over that, that allows me to know that this patient has confirmed their visit for today. You'll also see here underneath the wait time, it has a little bit of a timer telling me how long that person's been waiting for the provider, how long they've checked in. This is designed so that way underneath your actions, you can actually select the patient tracking. And this allows the practice for efficiency purposes to see how long that patient was in the office from the time that they checked in to the time that they checked out. There might be some efficiency workflows that need to be addressed, and this could be used for that function here. Now keep in mind this is subjective because somebody has to actually change that status from checked in to transferred to ready to provider. It's not system automated, so somebody actually has to come in and do that inside a care tracker. If that is not done, then you would not be able to efficiently use this function to see how that is. So there is subjective, but it is a good way if you're looking to track efficiency inside the practice, from the time that the patient arrives to the time that the patient leaves. Underneath this action feature here, there's different actions that you can use inside of Clinical Today. This pull feature here will pull the patient into context, and all that does is place the name of that patient into the context feature right here. So now if you needed to go and edit their demographics, you could. If you wanted to send a to-do on that patient, you could. The next feature here is your visit. This is a visit capture feature. It's an electronic version of your charge slip that you would hand to the provider, who would then check it off and then give it to the patient before they check out. So that way when they check out, they hand it to the person who's checked out, so that it can be sent for billing. This is an electronic version of that. They can select the CPT codes for that particular office visit. Then they would be able to select the diagnosis codes, and then they would review that and save it. So that way it's now sent to the billing department. You also have your visit summary. So when a patient is now completed their visit, they're checking out, the person who is checking them out in the practice can now print out their visit summary. You can also access a progress note directly from Clinical Today just by clicking on this progress note, and it will bypass the patient's chart and go directly into the progress note. This is not a recommended workflow. It is an option inside of CareTracker, but it's not a recommended workflow. The recommended workflow for CareTracker, so that way you keep the appointment attached to the visit, which is now attached to the billing, is if the patient is on the schedule, that they are accessed by their name on Clinical Today. And all you need to do is click on that patient's name, and that will open up to the patient's chart. So now the person who is rooming the patient can start reviewing their problems list, medications, allergies, can also start a progress note if they needed to, depending on the workflow of the office. In doing the recommended way of opening up a chart, this allows the appointment to stay attached to the encounter, which then stays attached to the billing. This is the proper functionality and workflow that we recommend with inside a CareTracker, so that way you're not creating any type of duplicates. Sometimes it can cause triplications to be caused depending on how many people are seeing that patient or looking at that patient's chart. So you always want to keep everything in line together from the appointment to the billing, and that way it makes it a smooth transition at the end of the day. Another action is your open activities. If a patient has been seen and maybe an order has been created, maybe a recall has been created, they would be seen underneath the open activities for that patient. So you can see here that this particular patient does not have any particular open activities at the moment, but this allows who's ever checking out the patient to be able to print out that lab order or radiology order for them to go get that particular procedure done. It also allows to see that there's a recall. Maybe there needs to be an appointment set up at a future date, and it could be 6 months out, but the patient would want to set it up now. So you do have that ability from the Clinical Today screen. Patient tracking, again, it's a way that you're able to track to see how long a patient was, checked in before they were roomed, how long, before they were from their room to being ready for the provider. How long from being ready for the provider did they check out? It's a way to check the efficiency workflow of the practice. You also have encounter forms too, which are customizable for the particular practice. And this is a customizable form for that particular practice. And this is something that can be printed out and handed to the provider, so that way they're still checking off what procedures were done for that particular visit. And that way they can hand it to the patient, who will hand it to the person who's checking them out afterwards. Edit demographics. Now everything from encounter form actually down are all PM functions. These are not EMR functions, they're PM functions, but you do have the ability to edit the demographics for a patient. You can look at the open items for payments as well. You can collect a payment, and you can also add the patient to the wait list. Now these are PM structured functions, and that's why I will not be going into them today. They're reviewed with a practice's PM training. Moving over to the quick tasks, and I'm just going to edit my functionality here. Moving over to your quick tasks here, you have the ability to see the different tasks for the provider that is selected within inside the batch. For that day, for that week, you'll be able to see the to-dos, if there's any renewals that came in from the pharmacy that need to be addressed. If there are any new prescriptions that were created inside the office, they might have been saved and not printed, or they're saved because they're written on behalf of the provider, and the provider now needs to review them before they send them electronically. You can also see the change requests that come in from the pharmacy. Maybe it's a different medication because the one that they have is out of stock. It could be a different dosage that's sent in from the pharmacy. Whatever change request that may be would be seen underneath your change requests. If you have a lab and you're interfaced with a lab, the results would come into CareTracker and they would be found underneath your results pane here. Open encounters. Open encounters are anything that needs to be addressed as far as maybe encounters that have not been signed off. They might not have been billed based off of how the encounters are designed with inside your administration options. They might require a signature. They might require a signature and a bill. They might require just to be billed. So anything that is open that needs to be addressed would be found underneath your open encounters. Your next tab here is your open orders. This tab here will show you all the orders that have been created that don't have a result linked to them or entered in manually. So they will stay underneath the open orders until the result has come back from the lab or radiology, and it's now linked to the order, or a manual entry was put in for that result. Then you have your doc management. Doc management is all of the stuff that is scanned into the program. It could be medical records from another place or another provider. It could be paperwork that was submitted. It could from the patient's employer if you do workman's comp. It could be anything that's required a signature from the provider. It needs to be reviewed and signed from the provider depending on how it was scanned in. Voice attachments and untranscribed notes. This here is an actual old functionality with inside of CareTracker. It's no longer really used by CareTracker, but it cannot be removed because there are some practices who still use this functionality. So that's why that is still there. And then we have our unsigned notes. So this will show you any notes that have not been signed off by the provider. That is listed with inside your batch. They would be listed here if there was any notes that were not signed. And this is a way for you to be able to go in and just review those particular records. Now, sometimes practices don't want to use the quick task function here because they work for multiple providers at one time. They don't just work for one particular provider, but they can only select the one provider from the batch. So you have your task function tab right here. And if we click on this task function, it will open up to the task tab. And depending on how many open items that you have, it might take a few minutes for it to open. Sometimes it can take longer than others, depending again on how many open features that need to be addressed underneath the tasks. Because what this task tab will do will take all these quick tasks and put them all into one screen for you. So as you can see here, my default provider is Brett McFadden because that's who I switched to in my batch here. Now, he only has two tasks that are open here. They're open encounters. If I wanted to see somebody else in the practice, or if I wanted to see all, I have that ability just by selecting this drop down here. And each time I make a selection, I have to hit the word search for it to refresh the program to now show what I'm looking for. Since I've selected all providers, it will take a minute for the system to go through the system and look at what is still open. So you'll see here I have selected all my providers. My period here is the last 30 days. I could do last 60 days. I could do last 90 days. I could also do a custom date range where I just put a date in to and from here and hit my search. Below it shows me the date, the provider, which patient this is attached to, which task it is. Is it open encounters? Is it a lab result? It could be an unsigned note. And then the description of that task. Now the date and the description all are based on the task itself. So you'll have different dates for different things. You know, the unsigned note, when was the the note created. A lab result, when was that lab result received? So the date in the date and description is driven by which task that it is. You'll see here, this particular patient here is a new RX, and it tells me what type of prescription that is new. To open up the task, I can click on this task here, and it will open up to that task window. Now, depending on what that task is depending on what window will open up. This was a new RX, so you'll see here it gives me the ability to review this here. I can print it out, I can send it electronically, I can send it in a fax if I'm set up with our fax service. I can mark it as printed, I can reorder it, I can reject it. I can also hit cancel as well and close that out because maybe I'm not reviewing that at this point. If I wanted to see in the unsigned note, I can open that up and it brings me into the note that was not signed. So now I can continue documenting my note and be able to sign it off. So depending on which task is listed, is depending on what screen will open up. This is my lab results here. It opens up to the lab results that was received. So now I can review. You'll see here, this is a perfect example, going back to that batch. I have the ability, if the patient was signed up for a patient portal, I would be able, after I review this, to send that to them. You'll see here that this patient is not signed up for a patient portal because it does not give me the ability to send them the result. This just allows me to say that I've discussed it with them. You also have your task feature over here, very similar to quick tasks. Mine right now is click to all tasks, but if I wanted just to go into document management, I could just click on that particular task function, and it will open up to all the documents within inside of that task that I selected. So you'll see here, this is the document management for the practice. It's not based off of just one particular patient. It has all patients because I'm doing this from the Clinical Today screen, and I'm not looking at the document management from inside of a patient's chart. I also have the ability here from this screen, if I was through looking at the doc management, maybe I wanted to go into my open orders, I could come into my open order screen here, just from the task drop down. And it will change it now to the open orders screen, where now I can filter out the different, if I'm looking for a particular patient, maybe I'm looking for a particular provider's orders, I could do a custom date range. And I can continue to do this as I go through each one of these here. And again, these are all based off of the provider set inside of my batch. So you'll see that my provider is always listed here of who's set in my batch. But I do have the ability, if need be, to switch that provider. I can also see all providers, if need be. We also have this population management tab here as well. This population management tab is actually related more towards meaningful use back in 2013, 2014, prior to MIPS, which we now participate in. It's also been replaced by our population health module as well too. So this functionality is still here, but it was a way for you to be able to, send things and review things from different registries. It's not really used so much now because we do have our population health module here, which if your practice is signed up for, would be able to access it right from the Clinical Today screen as well, just by clicking on this button here, and it would open up to your population health tool. And it'll take a few minutes to load, again, depending on how much information is in there. So this is where now you would do all your reporting for MIPS ECQMs is done through this population health tool that we have here, and no longer from this population management. And again, it can't be taken out of the program because it's there for historical purposes, because again, it was used for meaningful use, and with those type of incentive programs, it's one thing to keep in mind that you keep your documentation just in case you're audited. So that's why it's still in the program here. But again, you have your population health tool here. Next to that, you have a links button. And what this links button is the practices have the ability to enter in web addresses that they frequently go to. So that way, when they're inside of CareTracker, regardless of where they are with inside of CareTracker, it could be on Clinical Today, it could be in a patient's chart, you have the ability just to click on that link, and it will bring you out to that web browser without even leaving CareTracker. It automatically opens up that web browser for you, so that way you're able to do what you need to do in that website and not have to close out of CareTracker, not have to click another button and type in the web address for what you're looking for. Sometimes practices will use a links option here for patient education. There might be a specific website that they like, that they want to be able to use that education and be able to print it out. And this is just a fast, more efficient way to get to that website without having to leave the patient's chart or CareTracker for that instance. If you are participating in telehealth and maybe you're using a third-party website for telehealth, you could put that third party's website within inside of the links option here, and that's done with inside your administration options. And that way you're just clicking on that link to now open up to that telehealth resource that you're using. We also have the help function here. This help function actually has a dual purpose. If you click on the word help, it will bring you into our help system. And in our help system, you have the ability to search different things on how to, EMR and PM. We have some training how-tos. You'll see that live webinars are listed here, recorded trainings, and then supplemental trainings are listed here as well. You have the ability to search in this field here, and it'll bring up all things with that particular word that you have or words within that search feature. You can include your all words in that search as well. And you'll see here that it populates all those different things that have the word batch in it. So depending on what you're trying to do, you can kind of read the little descriptions here and then click on that, and it'll populate it here on the right-hand side. You have the ability to print this out. You can remove the highlighted feature because you'll see that the word batch is highlighted throughout the document. You can also expand or collapse, and you can move this forward or backwards as well too. Also, this little arrow next to the help is where you can see the documentation for CareTracker. So in documentation, there would be release notes, there would be some how-tos listed. We have some for MIPS, the ECQMs, the promoting interoperability options are listed underneath the documentation link here. And that will populate into its own screen. You'll also see up here, you have the clinical toolbar function. You also have a clinical toolbar function within inside of a patient's chart. So these are different options that are being done for a patient or done to a patient. If you're adding a new patient within inside the practice, you can add in a new patient. If you needed to edit a patient's demographics, patient that's in context. If you're looking at info, patient's information, maybe your eligibility, maybe you're sending out a referral. If you're looking at their open items as far as payment. Has it been charged? Has it been paid? Appointments for that patient. Again, setting your batch. You have your to-do center here. It's one way that you can access the messaging center with inside a CareTracker. You could generate a letter from here. Unprinted patient correspondence is listed here. You can access your doc management from here and also your queues from here as well. You'll see if there's a patient in context, it gives you their total balance, their PCP, if it's listed in their demographics. It gives you also their insurance information here. If they have another appointment, it also shows you their last appointment. Above this, it's going to give you the date and time and also the user that is logged into this CareTracker session. It also shows you the version of CareTracker that you're on, if you're on Rapid Release or if you're on Live. CareTracker has 3 versions, actually. They have a beta version, which is exactly what that says, beta. It's stuff that's wanting to be upgraded or wanted to be released within CareTracker, but it's now in the beta function so that it can be tested to see if it works, if the workflow is correct. Once it passes beta, it would be moved up to Rapid Release, and this is the version that I'm in here. Rapid Release always has the newest functions that have been released for CareTracker. And then after these functions have been on Rapid Release for a period of time, they are now moved up to the live functionality. Users have the ability when they're first logging in to switch to either of these. I don't recommend beta for everyday workflow. If you are testing out something inside a CareTracker with our development team, then I would recommend using the beta. But for everyday use, either Rapid Release or Live. And then you'll see that you have this log off feature, so that way when you're done with your session of CareTracker, you can log off. And then you have your name of your practice here. If you have any questions, please reach out to your support entity, and they'll be more than willing to assist you. Thank you.